So my name's Albert Bevan, and I come from the Bardi, Nyulnyul, and Gija tribe, which are three different language groups in the Kimberleys. My role at the moment is around mental health and well-being. I'm a support worker at the local regional Aboriginal Medical Service where I work. So I also facilitate and coordinate groups for aged care and NDIS. Everybody wants to feel connected. Everyone wants to feel validated. You know, they want to have value in their life. And sometimes our mental health challenges can be a really big barrier for a lot of people. And you know, what I've learned through my training and what I do through my job gives me really genuine satisfaction, because I can see that, yeah, it helps a lot of people, you know, cope with a lot of these challenges. So the advice I would offer young people that are looking for a career in health is go for it. Really, really go for it. There are so many opportunities now for us that come from remote communities, you know, like I grew up in a remote community. I never imagined that, you know, I'd have the opportunities I have now in regards to working as a mental health officer. The training that I did that helps me with what I'm doing now in my role at Brahms, it was the Cert 4 in mental health. It was fortunate that I had the opportunity to train here in Broome. There's a local Indigenous tertiary campus that offers the training, which is called the Kimberley Aboriginal Medical Service, and they deliver the Cert 4 in mental health. You know, and I still want to do more training and become a psychologist and a counselor. So, you know, those were things that I thought, because of being so remote and, you know, being in the middle of nowhere, you know, it wasn't even possible. There are so many opportunities that are available, not only to, you know, those that live in towns and cities, but even those that live in the most remote communities, you know, and there is ways that we can, you know, provide support for people that live in remote communities to do this type of training. And, you know, if you ever want to grow up, and if you want to be a doctor, if you want to be a nurse, if you want to be a physiotherapist or a mental health worker like me, you know, it's really possible. And there is so much, you know, opportunities out there, because, you know, there's not enough of us working in this space. And, you know, I think the more sort of local faces that we see working in our clinics and in our hospitals, you know, the more safer our people are going to feel.